Hypertension in dogs is basically more of a secondary condition rather than a primary condition, unlike in humans. It's very, very, very rare for dogs to have a primary hypertension or high BP issue. And when I say secondary, it means it's because of some other underlying condition. It can be because they have a kidney disease, it can be because they have a thyroid issue, it can be because they have Cushing's, because they have diabetes. Any of these multiple reasons, a cardiac issue, any of these can lead to hypertension. But of course, because all these signs are again internal, it can be difficult to catch on at an early stage. So that's why some symptoms which are related to hypertension can be a hint for you that you need to get the remaining tests done as well, or you need to find out what is the underlying cause which is causing the hypertension in dogs. So what are the symptoms that you need to look out for? It could be something like disorientation, seizures, walking in circles, or else just having some nosebleed, redness in the eye. That means one of the smaller vessels in the eye probably ruptured and it's all the white part which you can see has become completely red. So there are various other symptoms that you can notice which would point towards a high blood pressure, and that is when you need to take your pet to the vet and get the BP checked. It's really easy to get the BP checked. Sadly, unlike humans, you can't do it at home. You have to do it at the vet. The only things required are your pet stays still and cooperates. Because usually we can't get a reading in just one go. We have to take 2-3 different readings and then take an average of that. It's because of various factors, because there's a lot of hair on the coat. It's because, of course, there's going to be some friction and movement. So that's why we need to take 3 readings and an average of that. But more importantly, your vet will need to do a lot of other tests to find out the underlying condition that is causing the BP to go up. And then based on that, your vet will either probably start the medication for the underlying condition, but also some medication for the BP. Most of the meds are same as what you would have in humans when you have a high BP issue. It's generally not a lifelong issue. If you control the underlying problem, the BP can also come under control. And how often should you actually get it checked? If your pet already has a BP issue or an underlying issue, then I would say every 3 to 6 months. Otherwise, if it's a senior dog above 7 to 8 years of age, then probably every year. So if you just do this, you can keep your pet's BP under control as well.